Hello, everyone. I'm Michaela Arsenault. I'm a project manager at the Central Oregon Health Council, and my pronouns are she, her, and hers. I wanted to welcome you to the 2023 Community Health Projects Information Session. Today, we're going over the grant opportunity and application process to support your success. To accompany this presentation, we have a frequently asked questions document linked in the description below. Before we get started, we want to introduce the staff that supports this grant opportunity. My role is to support the Community Advisory Council in the design, development, and operation of the community health projects. I'll pass it off to Gwen and Kelly to introduce themselves and their role with the grant.
Hi, everyone. I'm Gwen Jones, she, her, hers. I'm also a project manager supporting the Community Advisory Council in this grant opportunity. Kelly?
Hi there, I am Kelly Adams, she, her, hers. I am the grant platform manager and I support the project managers with the Community Advisory Council. I'm here to help you with questions about the grant platform and navigating the system.
We also wanted to acknowledge the Community Advisory Council. They're an amazing group of community members and local county representatives. Their purpose is to ensure Pacific Source Community Solutions, who manages the Medicaid benefits in Central Oregon, and the Central Oregon Health Council, remains responsive to the health needs of the community. Most of the members have lived experience caretaking or personally receiving Medicaid benefits. The Community Advisory Council, with the help of Health Council staff, is responsible for the Community Health Projects grant opportunity. They are in charge of the process design and funding decisions. So let's look at what we're covering today. First, we're going to go over a high level of what the community projects are. Then we're going to take a closer look at the specifics of the 2023 Community Health Projects request for proposals. This includes what the CAC's looking for, how it's designed with 3 separate RFPs, the scorecard, and how and when decisions are being made. Then Gwen is going to go over the applications and funding restrictions. Lastly, Kelly is going to go over how to access the application and set up an account. Then she'll provide information on how to reach us if you need help, and share with you grant writing support that's offered through the Health Council. So what is the Community Health Projects grant opportunity? They are community-level projects focused on improving population health and healthcare quality. So this means that funds cannot be used for projects benefiting a single household or individual. They're focused on addressing social determinants of health and health equity. Social determinants of health are non-medical factors and forces of someone's daily life that impact their health outcomes. If you look at the wheel below, examples of this include having safe, walkable neighborhoods, having good social support, feeling that you belong within your community, your socioeconomic status, and ease of access to healthcare, education, and other resources. What we mean by health equity is that everyone has an equal opportunity to be healthy. This might look like providing additional or individualized supports to make this happen. Another requirement is that the projects need to center Medicaid or RHIP members, but can include and benefit others that are not on Medicaid. It must also align with at least one of the 6 Regional Health Improvement Plan focus areas. There's a link in the description below where you can access the Regional Health Improvement Plan and Executive Summary. Gwen will also touch on this later. So what does the 2023 Community Health Projects grant look like? If you visited the Community Health Projects webpage, you may have noticed that this year's grant design and focus are different than previous years. This year, there is a separate RFP and application for each of the counties in Central Oregon. The counties in Central Oregon include Crook, Deschutes, Jefferson, and the northern part of Klamath County. The RFPs are based on whichever county your project or services are located in. If you are unsure which county your project serves or which area is considered Northern Klamath, you can click on the Here button in the paragraph above the counties. For further clarification on which RFP to choose, if, for example, your office is located in Bend and you see clients that travel from other counties to seek your services in Bend, you would apply using the Deschutes County application. The RFPs are based on where your services are located. However, say your office is located in Redmond, but you travel to Madras to provide food boxes, you'd apply using the Jefferson County RFP. If you want to request funding for projects in different counties, you'll need to submit a separate application for each county. Also, when you click on the RFP, each county has their own access code, and each county has their own specific pool of funds. The funding is based on the poverty rates of each county. The CAC designed it this way to center Medicaid recipients. And 2, socioeconomic status is a predominant social determinant of health. The funds were not distributed among counties equally, but equitably. Reflecting back on the equity image, the CAC separated each county because they know that each community is different and might need additional or individualized supports. Specifically, you may notice that the rural counties have larger award pools. We know that people that live in rural areas generally have less access to healthcare and other resources. And projects may cost more in rural areas than urban because there is an existing network of services. Also regarding this year's grant, the Community Advisory Council wanted large impact projects, so each grant request must be a minimum of $100,000. These funds can be used all in 1 year or spread up to 5. For smaller organizations, this could help build sustainability. And applicants are also encouraged to collaborate with other organizations. Now let me show you how to access the request for proposal and how the applications will be scored. We're going to go over to the Central Oregon Health Council website at cohealthcouncil.org. To locate information on the community health projects, you'll click the More button, come down to How to Apply, and go over to 2023 Community Health Projects. Once you're on the Community Health Projects webpage, you're going to scroll down to the bottom to locate the request for proposals. I'm going to select Crook County, and you'll notice that the county that you selected will appear in the upper right-hand corner. On the RFP, you'll notice that there's an overview of the community health projects and the qualities of the applications the Community Advisory Council is looking for. The Community Advisory Council are prioritizing applications that provide basic needs like food, water, shelter, clothing, and hygiene products. They're prioritizing applications that prioritize people from communities experiencing health disparities, that meet the characteristic needs of the people being served, that serve rural communities, and that are locally based and focused. Below that, you'll see the funding details. Remember that requests must be a minimum of $100,000. And for Crook County specifically, their award pool is $391,954. Coming down, you'll see the project requirements that we went over earlier. Applicants must have a EIN or tax ID, but organizations that apply can be both nonprofit or for-profit organizations. You will see the list of project restrictions that Gwen will go over in a few moments. Next are the funding details and important information. So you'll see the total award pool, the minimum award request, and the application due date. These applications are due by August 25th before midnight. And we will let applicants know of the funding decisions by November 2nd. You may be asked additional information or to present at a Community Advisory Council meeting. Under the How to Apply section, you'll see instructions on how to apply, as well as the access code for Cook County applications. Keep in mind that access codes are different for each county. For Cook County's access code that you'll use in our grant management platform is 2023 Crook. And you can access the grant platform with this link right here. Below that are supports. You have Kelly's and my contact information if you need to reach us, if you have any questions. And then we have resources and definition. So we have our grant writing support. So Kelly will go over definitions of social determinants of health and health equity, as well as our definition of priority populations in rural. All right, moving over to the scorecard. So this is how your application is going to be scored and compared with other applicants. On the scorecard, you have each category bolded with a description below and the max amount of award points for each section on the right. All scores will be added up with a maximum amount of 65. The first section, the CAC wanted to encourage organizations that have not been awarded community health project funds specifically in the past by awarding them with 5 points. The second section is regarded to the project description overview. They're looking for applications that are easy to understand what the project plans to do and is clear how the project positively impacts social determinants of health and health equity. The next section is on equity. They're looking for projects that include strategies to meet the characteristic needs of the people being served, and that the project prioritizes people from communities experiencing health disparities. They're also prioritizing projects that serve communities, and there's a definition below. And that the projects were created by and for the people in those specific rural communities. And the applicant services are provided within those communities or county. They're also prioritizing projects that provide basic needs like water, shelter, clothing, and hygiene products. And lastly, they're looking at that the amount of funding requested makes sense for the project description or descripted. And below the scorecard is the definition of rural. For our definition of rural in Central Oregon, that means any location outside of Bend and Redmond. Now I'm going to pass it over to Gwen to go over the application. Thank you.
Now we're going to look at the application. First, we'll orient you to the application, and then we'll share with you what the Community Advisory Council is looking for with each question. For this information session, we're going to be using the application for requests coming from Jefferson County applicants. Questions are primarily the same in each county application. So let's first start with an overview of the whole application and then look closely at each part. First of all, there are 6 parts to the application. I'm going to scroll through and show you each part. Part 1 is project highlights. Part 2 is community impact. Part 3, project details. Part 4, project objectives. Part 5, project support. And Part 6, budget information. Within each of the 6 parts are a variety of questions. Questions that require answers have a red or orange asterisk next to them, like this. These questions will require an answer before allowing you to submit the application for review. Each question will allow you to answer the question in one of 3 ways: by writing in text, such as this, selecting a provided option, or uploading additional documents. Questions that ask for text answers indicate how many characters or space is available for you to answer each question, like this. You do not need to use all the space that is available. Now that we're oriented to the application, let's look at each part. Beginning with part 1, project highlights. This is where you provide high-level project and contact information. The project name is simply the name of your project. The amount requested is the amount of funds you are requesting. Project duration: how many months will the project last? Please be sure to indicate it in months. Under organization, you get to give us a little description about your organization and how you generally serve the community. Name of project lead, email for project lead, and the phone number for project lead is the contact information for the person who is primarily responsible for this project. In part 2, community impact, this is the part where you share about who your project will serve. So the first section or question is around communities in Jefferson County that are included in the project. This is a multiple choice selection, and you will select the communities in Jefferson County that the project serves. If your community or the communities you're serving are not listed, you'll select other. And then you can write in the name of that community in the next question. And this question around serves tribal members. This question is oriented and for applicants whose project serves mostly tribal communities and tribal community members. If your project does not focus mostly on tribal communities and tribal members, then you will answer none. For example, if your services are provided in Jefferson County or another county, and you serve everyone who walks in the door, then you will answer none. If, however, your project serves mostly tribal communities, then you will select the appropriate tribes. For example, if your organization has an office or staff member located in Warm Springs, and the majority of people served are tribal members, then you will select Confederated Tribes of Warm Springs. When you indicate that your project serves primarily tribal members, then a memorandum of understanding is required. This is indication that your project serves primarily tribal members, is on tribal land, or partners with tribal nations. You will need to provide documentation that the tribal government has granted your organization permission to do so. You will upload a memorandum of understanding or a letter of support from the tribal nation. This documentation needs to indicate that your organization and this project has been granted permission by the tribal government to function on the tribal lands and for tribal members. Prioritize populations. This question is for applicants whose project primarily serves mostly people who identify as Black, Indigenous, people of color, American Indian, Alaskan Native, BIPOC, and Alaskan Native and American Indian, people with low income, people who identify as lesbian, gay, bisexual, transgender, queer, and questioning, people with disabilities, and people living in rural areas. If your project does not focus mostly on services to these individuals listed, then you will answer none. For example, if your services are provided to everyone who walks in the door, you will answer none. You can either select the none option or the other and enter in none. If your project mostly does serve any of these populations, select the appropriate priority population. For example, if your project serves mostly people with disabilities, then you will select that option. Or if your project serves mostly Latino community members, select the first option. You can select more than one population. Later in this application, you will share specifics of how your project is personalized to the population this project serves and how they are involved in planning and implementing the project. The next 3 questions ask you to estimate how many people by age group your project will serve. Children and adolescents served means people from birth to 17 years old. Adults served is defined as 18 to 64 years. And older adults served, meaning people 65 years old and older. In part 3, you will provide a detailed overview of your project, including a fuller description of how it meets some of the funding guidelines, how it will be developed and evaluated. The first 2 questions in this part ask about the project timeline. Start date and end date. Share the date that you'll start the project and when you think it will end, or when the funding will be used up. There are no requirements around the project start and end dates. For project aim, this is simply 1 or 2 sentences describing the big picture of what your project will do. For example, it might look something like, this project will help people who are transitioning out of homelessness stay in their transitional housing situation. Or another example, this project will provide people with disabilities with accessible, inclusive activities to build a sense of belonging and healthy living. Or another example, this project will improve a community playground and walking paths in an economically underdeveloped neighborhood to increase outdoor physical activity for youth. The project description and overview is where you'll provide more detailed, expansive description about the aim of your project as you highlighted it above. Under why the project is needed, you'll share the why of your project. Why is it important? How did you get to this particular project? In this section, you may include things like the background leading up to the project development, local research, data, community conversations, shared learning, and stories. Under community-based, this is where you explain the details of how this project is serving the communities and county you indicated in part 2. This is an opportunity for you to share about your presence or your organization's presence in the community that these funds are invested in. As an organization providing services in Jefferson County, for example, you would share what services you are specifically providing, how you are providing them, and how often and in partnership with who you are providing them. For example, as a Jefferson County applicant seeking a project to be funded in Jefferson County. An example of that might look like, we are using our mobile unit staffed with local Jefferson County residents to deliver food boxes to the outlying community centers and houses within Jefferson County 4 days a week. To qualify for this funding, projects must support one of the community priority areas outlined in the 2020 to 2024 Regional Health Improvement Plan. Please review the aims of the 6 priority areas and then select which priority area your project will support. We suggest that you select this link in the application or the link provided below and look at each priority area carefully and identify the aim that is most appropriate. You will then select the priority area that closest aligns. You may select more than one. The next question will ask you to share how your project supports the priority area aims that you selected above. Another qualification for this funding is that it must be available, or the project must be available to people who qualify for the Oregon Health Plan. To better understand who qualifies for the Oregon Health Plan, please see the link below. You will select your answer. If you have questions, please contact the Central Oregon Health Council staff. Projects must also help with one of the listed social determinants of health. You can reference the link below for more information and explanation of each type of social determinant of health. You can choose one or more options, and then you'll explain how your project helps with that social determinant of health that you choose. There are 2 questions in this equity section. In the first of these 2 questions, you are describing the specifics of how you are personalizing the services to meet the needs of the priority populations you identified earlier. For example, if you are serving people who speak Spanish or another language, you will share how you are providing interpretation services and translated materials. Or another example is if you are serving people living in rural areas, you might share how you are addressing the geographic isolation of the people you serve with your project, or how you are using images in your materials that reflect the rural cultural way of life. In the second of these 2 questions, you are sharing how people who this project serves are involved in the planning and carrying out of the project. This is showing how your project lives out the expression, "Nothing about me without me." For example, if your project is serving people who are Spanish speaking and Spanish culturally, you might share how you meet regularly with folks from the Spanish speaking community to review and revise how and where your services are provided. Or another example, if you are serving people living in a rural area, you might share how you will pay a group of neighbors from a rural town to help carry out the project. Best practice and evidence-based guidelines. If your project is based on a previously developed data-driven or research-based model, share that here. You can also include any culturally specific emerging best practices. If your project is based on an evidence-based or best practice model, share how you will review how closely your project follows the model, also known as fidelity. If this does not apply to your project, simply write NA, non-applicable. Evaluation and project success. To understand project success, some projects might undergo a formal evaluation by a paid evaluator. Other projects will utilize the project objectives they develop for the project. In this question, please share how you will know if this project did what you planned for it to do. Part 4 is where you get even more specific about what this project will do. This part is made up of instructions, examples, and finally spaces to add your project's objectives. The directions at the beginning of this section, or this part, talk about how the goals should be written. We like to use SMARTIE format. SMARTIE is an acronym or abbreviation for specific, measurable, achievable, relevant, time-bound, inclusive, and equitable. It builds equity into the more traditionally used SMART goal, which includes just the SMART. Please see the link provided in the application and below for more detailed instruction and support for writing SMART and SMARTIE goals. Next comes the spaces where you will add your project's objectives. There are 2 parts for each objective: the object description and the objective. The description is a description of what the project is trying to do, and the objective is a way to count or show what was done. This is where the SMARTIE goal is added. Overall, there is space for 4 objectives. Please note that only 3 are required. Let's look closely at the objective description. Here is where you will share what you are trying to do. For example, this project will improve dietary health through increasing the eating of fresh fruits and vegetables. Or another example, this project will decrease food insecurity. The description is then developed into a detailed objective with all the parts of a SMARTIE or SMART goal. For example, by March 15th, 2026, of the 200 participants, 80% of them will graduate the program, and 90% of the graduates will increase their fruit and veggie consumption by 2 cups. Or another example, by May 30th, 2025, we will provide 200 Spanish culturally specific food boxes with high quality client recommended food items. Part 5, project support, allows you to attach letters from community partners that support or will contribute to your project. These are optional. There is space for up to 5. Part 6, budget information, is where you provide details about the funding you are requesting. There are some initial directions and then space for you to upload your documents. Let's start with reviewing the instructions. First, we have a list of the funding restrictions. These are the things that the funds cannot be used for. We will dive more into this later. At the top, we provide a budget template that you are welcome to use, or you can upload your own. The budget can be for a 1-year or multiple year project. Please note that the Community Advisory Council wants to see the budget detailed out by year. However, if the grant is approved, the entire awarded amount will be released in one lump sum. And finally, if this funding will be used to match another grant for the same project, or if you are seeking a matching grant to this one, please say so here, and then tell us how much. Congratulations, you've just completed the grant application. If you have any questions, please don't hesitate to contact the COHC staff. Let's continue with funding restrictions. As we mentioned earlier in the application, there are some restrictions around what can be funded. This grant funding is made available to the community through Medicaid. Because Medicaid is tied to federal and state regulations, this funding has some restrictions. We're going to review them next. I want to let you know that this is a high-level explanation of the guidelines as they are available at this time. This is not intended to be an exhaustive explanation of what is and isn't eligible for this grant funding. If you have questions unique to your project, the Health Council staff will work with you, our coordinated care organization, and the Oregon Health Authority to answer them. You can also find additional information provided by the Oregon Health Authority in the links below. So let's start off this section by looking at two different definitions that are going to help us better understand the funding restrictions. So the two definitions are a covered service. So a covered service is any product or service that can be reimbursed by any health insurance plan. Covered services include, but go beyond, things like physical, dental, and behavioral health screenings or care, durable medical equipment, medications, and non-emergency medical transportation. The other term that becomes important when we're talking about restrictions is provider. For the purposes of this conversation and this work, a provider is defined as any entity contracted with Pacific Source Community Solutions to provide services to Medicaid recipients. You'll see how this becomes important as we look at the restrictions next. So let's look at our restrictions one at a time. The restrictions that we have do not allow this grant funding to be used for any service or product that can be reimbursed by any health insurance plan. So this funding cannot be used for things that are covered services. It can also not be used for things that we know will become covered or reimbursable in the future. Second, activities that support the delivery of reimbursable services are not eligible for funding. The delivery of care itself, or those the support and activities that support the care delivery, is considered part of the reimbursable service and therefore not eligible. Finally, workforce training for anyone who provides Medicaid covered services is not eligible. And when we talk about workforce training, this is applicable for workforce training for providers, as provider is defined above, as somebody who provides Medicaid covered services. So this is because workforce training is considered an administrative expense. There are many housing related activities that are eligible under this grant funding. There's a link below that will give you a full list of examples. There are, however, two housing related activities that are not eligible. The first is any ongoing rental assistance that is not related to crisis intervention, stabilization, or transition for a patient and or not associated with a direct health benefit. This rules out funding things like a long-term ongoing rental assistance voucher program. The second that is also not eligible is directly funding development of new housing units. We often use the terms brick and mortar development. On a different vein of thought, health information technology that goes against Pacific Source's one vendor policy is not eligible. There's more information available for this in the frequently asked questions that will be released shortly. And finally, the Department of Human Services, DHS, and Oregon Health Authority, also known as OHA, may not apply for these grants. Once again, if you have any questions unique to your project, the Health Council staff will work closely with you, our coordinated care organization, and the Oregon Health Authority to answer them. Now I'm going to pass it off to Kelly.
Thanks, Gwen. Now let's learn how to access the online application. First, you need to log into the grant platform. If you have an account and are familiar with the platform, you will need to log in with your email and password. If you have forgotten your password, click Forgot Your Password, then follow the instructions on how to reset it. If you're a new user or not sure if your organization already has an account, the easiest way to get set up is to email me. I will set up your account and then email you back with the grant platform link, your username, and a temporary password. I do recommend that you save the grant platform link as a bookmark on your web browser. Once you are logged in, your applicant dashboard will appear. At the top of the page, you will click on Apply. On the next screen, you will need to enter the access code for the specific RFP you want to apply for. At the top right of the screen, you will find a box to enter the access code. Here are the codes for each county. Enter the county code, hit Enter Code, and the application description will appear. To the right, you will click on Apply to access the full application. Once the application is open, you can start to enter your information. If you would like to download or print out all of the questions beforehand, you will click on the box labeled Question List on the right side of the screen. A PDF version of the application will open for you to save or print. Let's go back to the online application. As you are entering your grant information, a draft of your application will save until you hit the Submit Application button at the end. You can save your application as a draft or hit Submit Application. If you have not filled out all of the required fields, you'll get an error message letting you know which fields need to be filled out. If you have submitted a complete application, an email will be sent to confirm that it was received. Please remember that applications must be submitted by August 25th, and then you will receive the decision notification via email by November 2nd. During this process, if you have any questions, please feel free to reach out to one of us. You can ask for help by contacting Michaela or Gwen about the request for proposal, or myself for help with the grant platform. Lastly, if you feel you need more support for the Community Health Project's application process, Central Oregon Health Council offers free grant writing support. To qualify for this, your project must serve the Central Oregon region, and it must meaningfully impact a regional health improvement plan future state measure. The grant writing support includes up to 10 hours of support with a consultant. The consultant cannot write the grant on your behalf, but can help you interpret the requirements and review ideas for ways to answer questions, and can also help review the final draft if it is provided at least 10 days before the due date. If this sounds like a good fit for you and your organization, please contact me to get started. Thank you for spending your time with us today learning about the 2023 Community Health Projects application process. We look forward to hearing from you.